Hey, good morning, team. Today is the 19th of July, 2020, and it is my day 21 of the 22-day Suicide Awareness Challenge. Now, even though I'm getting close to wrapping up my Suicide Awareness Challenge, what I really want to do today is challenge all of you to pick up the ball and continue on the 22 days. And what I would really love to be able to see is to see this get down to the junior level so that they are picking up the ball and they are becoming aware of the risk factors and being able to better recognize warning signs and to understand that there is a lot of help out there. And where can we go to get that help? We've talked about the National Suicide Line. We've talked about the Vets for Warriors website. We've talked about Prevent and Reach. So those are all some of the things that we've talked about. And the reason why I want to have this continue, not just because suicide is a big public health challenge right now, is that we're also having a big spike of suicides throughout the military. And if it's going on like that in the military, I imagine it's going on all across the country right now. So I want everybody to become more familiar with the risk factors, warning signs, protective factors. I want us all to start getting better at the protective factors, and I'm hoping that that junior level, especially the junior leader, the junior supervisor, the squad leader, the battle buddy, that they can help teach and become better at the protective factors. Because let's face it, life in today's world is stressful. It's always been stressful, but new generations, as they come up, they have to relearn some of those things and adapt to what is going on in their times. So we've had our greatest generation, and I've always been in awe of how did they survive through all of the stuff that they had to go through. And think about it, World War I, World War II, all the things that happened. I mean, way back, right after World War I, they had their own flu plague. And then they had to go into World War II. They came out of World War II, and then you have things like Korea, Vietnam. You had all the civil unrest. So America has been through some really tough times. And they seem to get a little bit better every time. But there always still seems to be that fear that it's going to get tough. And so we have to keep working on our protective factors. We need to work better as a team. We need to be kinder to each other. So those are all some of the things that we can do to improve relationships and do, be able to help us get through and weather some of these storms. So I want everybody to pick up the ball, start their own suicide awareness challenge. Even if you're not doing push-ups, like I've been saying, just post something positive for 22 days. But really, you don't need to end at 22 days. We just want to be able to keep spreading the word out there so that everybody can become more familiar with risk factors, warning signs, and improve on the protective factors. So today's my day 21. I'm going to try to do push-ups again. I think I'm going to go a little slower. Oh. Okay, team. So what can we do to continue to carry this on? So September is National Suicide Prevention Month. So it is the 19th of July right now. We've had some serious engagement right now. We've had a lot of key medical leaders, especially in the medical chain, even the Surgeon General, retired Command Sergeant Major Ecker. We've had a lot of key leaders take that on, and I've seen some people through the different ranks stepping up. I would love to see retired civilians, even just family and friends of military, step up and continue this on, because this really is a national challenge, at least the way I see it. And really, we're gonna need everybody. We're gonna need everybody that you come across to have some more awareness for that. So for all of those people, and for all of you that take on this personal challenge to do this for 22 days and to help continue and move this ball forward to help reduce suicide across the entire country, not just the military, these two are for you. All right, everybody. Have a great Sunday. 2-2.